Okay. Well, I'll hand it over to Michelle.
Awesome. Well, it's wonderful to be here with you for your ground rounds today. Lunchtime and your time, and first in the morning here in Alberta. And so, as Corey introduced, my name is Michelle McDonald, and I work as a clinical practice leader, faculty liaison here in Alberta, out of the Calgary area. I work as well as the faculty liaison with the U of A Faculty of Pharmacy, and coordinate all of the institutional placements for hospitals across Alberta. And I'm very happy to have with us, and you'll hear from them later in our presentation, Erin Duteau and Sahiba from Edmonton, who are a preceptor-student pair who've participated in peer-assisted learning, and as well from Moncton, Mallory Price, to be sharing her experiences with near-peer teaching. So it's a pleasure to be with you all. I am a Dow grad, and so very much familiar with the Maritimes. I'm from Halifax area, Lower Sackville, and lived in New Glasgow for many years and worked out of the Aberdeen Hospital. So the Maritimes are near and dear to my heart, with many of my colleagues maybe are in the audience today. So great to be with you. So to get started, what our goals are today is what we're going to do is focus on different models of precepting, and as well talk about specifically peer-assisted learning and how it works, the advantages, some of the challenges. We want to hear from preceptors who've been experiencing these models and hear about their experiences, talk about some strategies for success, and then talk about how you can get started and consider piloting some of these exciting models into your practice of precepting. We know that we've had a traditional model of precepting with one preceptor to one student. Yet in our discipline, and as well many other disciplines such as medicine, nursing, physio, OT, dietary, lab, lots of different services, they've been experimenting and using different models of precepting for some time. We are familiar often with the medical model, which often uses a near-peer teaching, a hierarchical type of learning where you have an attending preceptor, a senior learner, and a junior learner. We can see that we have co-precepting as well as a team. When we think of the length of our placements being 8 weeks, maybe 4 weeks, 6 weeks, depending on the program and the length of for the level of learner, we know that it's difficult to, in the clinical schedule, as pharmacists rotate between clinical and dispensary functions, to have only one preceptor involved with that student. And then the focus today is going to be talking about peer-assisted learning, where we have two students working together with one preceptor, and they can assist one another and provide each other feedback. So as we look at what co-precepting is, two or more practitioners share those responsibilities of precepting, and they work as a team. That can happen simultaneously. Maybe you have two pharmacists assigned to one clinical area, or it can happen sequentially, where perhaps in the schedule of a placement, you have one preceptor for the first 2 weeks, another preceptor for the last 2 weeks, and it can be organized in that manner. In near-peer teaching, which Mallory is going to speak to today, this is where we talked about that hierarchical model, pyramidal learning, and so you see that senior elite learner providing support to the junior learner. And there can be a lot of feedback provided, a lot of mentoring and supporting, and then the attending pharmacist oversees both students and supervises them, and questions that both learners need to bring to the preceptor can come in that manner. It also gives that senior learner that opportunity to have experience precepting. Our focus today is going to be talking about peer-assisted learning, and there's a lot of similarities that you can glean to the near-peer teaching, so keep that in mind as we progress and talk about these different models. So in peer-assisted learning, you can have 2 or 3 or more students assigned to one preceptor or perhaps a precepting team. Here in Alberta, most of the time, precepting is happening as a precepting team, unless you're a sole practitioner in a rural institution. So what happens is these two students are at the same level, so two second-year students, two fourth-year students, two PharmD students. We have a post PharmD program, and they are helping each other to learn and learn themselves by teaching, and we're going to be focusing in on that. We're going to have an opportunity at the end as well for questions. And so as many of you are in the room today, think about those questions, write them down throughout the presentation, and we'll have that opportunity for you to share those and ask of myself. And unfortunately, Ann Thompson, her audio isn't working. She can see our slides. I guess I forgot to mention who she was. Ann is our Assistant Dean of Experiential Education at the U of A Faculty of Pharmacy. She's been a strong proponent of peer-assisted learning and near-peer teaching and co-precepting, and very involved here in Alberta as we have implemented these models. So unfortunately, the technology is not working very well today for her to have her audio on, but I do believe she's listening through Doug's phone, so able to hear what's happening. So getting to know you, as Corey just went through who is here, one of the things we wanted to get an idea is how many have experience using the model. And so I know we've got St. John and Fredericton and Moncton, and I'm not sure, Keith and Susan, where you guys were calling in from. But if you could write in the chat box where you're from and how many people are there, which I know you've already indicated, but how many have experience with a novel model, and perhaps which model? So I'll give you a moment if you can write into the chat box, or feel free to unmute and share what experiences we have around New Brunswick today with a model of precepting. Awesome. Thanks, Keith and Susan and group from the Miramichi. Excellent. So Susan from the Miramichi is talking about how you have done co-precepting and sometimes peer-assisted. So that's excellent. It'll be interesting to hear, you know, as we get some opportunity at the end to share more, also as we share some things today, how that relates to your experiences. Anyone else from Moncton, Fredericton, and St. John? Okay, so thanks, Glenn. From Fredericton, we've got near peer and co-precepting have been used in that area. And in Moncton as well, peer-assisted, near peer, and co-precepting. Awesome. And Heather, thank you. Mostly one-on-one, but some near peer. So it's great to kind of, as we look at what's happening around New Brunswick, we are seeing these models being used across Canada. BC all the way across and into Newfoundland. There's a huge interest, as we know, as capacity needs are growing, but also thinking of, you know, expanding our precepting practices and utilizing these models. Many other disciplines have seen these benefits as well, benefits to the learners and benefits to you as preceptors. So thank you all for sharing, and thank you, Krista from Sussex. And welcome to a clinical dietitian who's with us today. So awesome. It's great to have all our allied health together as we talk about this. So we're going to move in to talk about peer-assisted learning and relate these. And as each of you shared your experience of how you've had learners, whether that's on a one-on-one model or you have experimented with the peer-assisted or near-peer, I'd like you to just reflect on those experiences today. And think about your time precepting and how these principles can, and how this could work in your own practice, how you can relate it to some of the experiences you've already had. So we think about, how does PAL actually work? And so really, if we want to think about a day in the life of a pharmacist and having more than one student with us, often what happens is those two students are very much responsible for their own patients that they would be following and working up. But as the day progresses, you're able to do orientation as the students have come together, do those together with the 2 students or 3 students that you may have assigned. Often what happens is the students check in with you in the morning. They would go work up their patients, be part of rounds, whatever your clinical flow in your practice is. The 2 students then throughout the day can be providing feedback to one another. So whether they whether they work up their patients separately and come together and provide each other feedback, or perhaps they observe one another doing an interview or participating in doing medrec or other types of things, they can be observing one another and providing each other feedback. Or they can also be doing some of that work independently, coming together and reviewing their patients together. When you go then as a preceptor to have a therapeutic discussion or review the patients for the day, they both then are able to present their patients to you, listen to their peer, interact, and as those questions come up, you're able to talk about them as a group, provide feedback to one another, and have that collective discussion so that you as a preceptor, the questions that are coming to you are a higher level. They've worked out many questions amongst each other, and then you're able to provide them feedback. So it's kind of a little bit about how we've seen it working. Different preceptors at their site try to make it happen into the flow of the practice that's working for you. So when you think about these activities that the students can be doing, it's really what can be done in a collaborative way.
Because when I look
there can be site orientations, patient assessments and treatment plans that can be done together, therapeutic discussions, journal article reviews, patient care presentations, educational sessions, and projects. And the idea is that the students are still intellectually responsible for their own participation in their own work. So it is now an ability for them to share and do things together so that they can provide each other feedback. And so as they document, as they do patient interviews and history taking, provide education and assessments, they can be providing feedback to one another, enriching their learning, discussing their learnings of the patients that they have been following and the application to patient care. And so that peer learning that can happen really enriches their experience. And for you as a preceptor, these are still conversations that you've been having one-on-one often with when you've had the one-on-one model. Now you're having that with 2. So what in essence you're doing is overseeing those 2 students and their patients, and when they're working on things, then you're able to perhaps work on other projects, or you're working on more complex cases and following up other things, depending on the level of learner that you may have. So why are preceptors adopting peer-assisted learning and even the other models that we spoke of? And we see this across the country. We see this, as I mentioned, in other disciplines. So preceptors are seeing advantages, and these have been documented in the literature. There's been systematic reviews of the literature in this regard. Pharmacy does have some contributions to that literature, although it is small. We did do a survey here in Alberta, and as well in British Columbia, there was some focus group interviews where preceptors were approached as to the advantages that they found with these models. So for peer-assisted learning, they are seeing that it's as efficient as having one student, because the majority of activities can be done together. And that collaborative problem solving that I spoke of, and that ability to discuss things, and it fosters that independence. It also increases the patient care capacity that can be seen. As you can imagine, having 1 student versus 2 students, or perhaps 3, then you can, more patients on your unit are cared for. That collaborative feedback means that there's less reliance on you as the preceptor on simple tasks and simple things, so they are providing feedback and working out questions on their own. And they become more targeted and tangible to you, back to you as the preceptor. But what do learners think? And it's going to be great to have Sahiba here on the call today to hear her experiences. And students as well report that they've found that this provides them opportunities to share knowledge. It encourages their own clinical independence. It develops those teamwork and collaboration skills because, as we know, as we work in our environments, we don't work alone. We work as a team with other allied health, with our pharmacy partners. And so having this peer learning models that teamwork and collaboration. It increases confidence and that intimidation when you come to a site on your own. It provides opportunity for those richer discussions and peer support. And it does increases that workload efficiency and effectiveness. So these have been all the advantages that have been identified. And when we think of, we will talk a little later on those strategies for success, because what might be going through your mind is sometimes some of the challenges that also come from having more than one learner. And we are going to speak to that as far as space, learner assessments, and different things like that of how we can overcome some of those challenges of having more than one learner. So what we see is preceptors are adapting this model and really looking at the planning for their placement. And planning ahead is critical, and Mallory or Erin may speak to that today, but as you think about having a student one-on-one, planning ahead to have two or more is essential. And thinking through things like space and how you want to organize your time, patient assignments and things like that, how you want to structure the orientation, what are going to be your expectations for the students, what are your equipment needs, and really thinking through the normal activities you would have done one-on-one, and now how am I going to incorporate another learner? So whether you're looking at that as a peer of the same level, so they're working through the course syllabus in the same way, or if you have a senior learner with a junior learner, you're now also thinking about those senior learners' learning objectives and expectations and the junior learners, and looking at how that is going to integrate in your expectations of those two levels of learners. So the exception is the fact that student performance assessments would be done individually with each learner to respect privacy and to also allow you to have that one-on-one contact with the student to be able to discuss their performance and give them that one-on-one feedback. That one-on-one feedback doesn't just have to happen at those formal touch points of midpoint and final assessment. They can also, and I encourage them to happen throughout the placement. However, for sure you will be scheduling the student performance assessment separately. So that's helpful to plan ahead as to when those can be done, and we'll speak to that a little bit later. So as we think about adopting this, what's excellent to have on the call today is we do have experienced preceptors with this model, and we welcome Mallory and Erin, and as well Sahiba, who is now a pharmacy resident in the Edmonton zone with Alberta Health Services and recently graduated. And her and Erin were a preceptor dyad, and they had Sahiba worked with another peer in home care in Edmonton this past year. So what I'd like to do for the next 10 minutes is have an opportunity to interview Mallory and Erin and Sahiba to have them share with you their experiences with peer-assisted learning and near-peer teaching. So Mallory, we're going to start with you, and I'd like just to have you share, and we'll have Erin share after you, is why, tell us and the audience today, why do you use the peer-assisted or near-peer model in your practice?
Hey, Michelle, it's Erin here. Do you want me to jump in?
Sure.
Or?
I'll just check. Mallory, are you with Doug today?
There you go.
Yes, sorry, I'd started, but
Okay.
it was not.
Oh, no worries. I'll start.
So here in Moncton and in St. John, we have a teaching rotation as part of our residency program through Dalhousie. So that is when a resident takes a fourth-year student for a 3-week rotation. And I really find that having 3 individuals in the emergency department really allows us to work patients up more thoroughly. We can see more patients and really increases the efficiency in the emergency department.
That's excellent. So it's such an excellent, so it's already set up through the residency program as an expectation, right, of the resident. So it's quite a unique opportunity. That's excellent. Erin, tell us a bit why you've been using this model in your practice.
Sure. So I've precepted one-on-one several times, but I was in a hospital practice about 6 years ago when I started trying the PAL model, and I found that it worked so well for me and my students that I wouldn't even consider going back to the one-on-one unless I had to, of course. And it's been a great way to actually increase my ability to provide patient care when I have a student rather than reduce it, once the students are comfortable, of course. And then during those times that I have to do non-clinical work, I don't feel like the students are left to their own devices. It actually makes precepting easier for me, I find. And I think the students learn almost twice as much because they're exposed to more cases and they learn from each other, not just from me.
Well, and it's really neat to see that you were able to, integrate the PAL model when you were working in an acute care hospital, and I know now you're in a home care environment, and so being able to even use that model in both places. And I'm glad that that's, been your experience. So how, as you talk about having used the one-on-one model and then now using PAL, how do you integrate precepting the two students into your practice?
Hi. Okay, so it's really not any different for me, I find, in terms of the fact that you're planning ahead is really critical if you have one student or two. I do run into challenges if I don't have it planned out in advance, and I do have to also be flexible to make things work. So I've had to put students in the cafeteria in the hospital, in the staff lunchroom, and even in other people's desks in home care when they're out of the office. So the other thing I think is really important is providing feedback regularly, being really constructive, especially when there's two people there. You want to make any errors that happen a positive experience. And it kind of promotes the fact that pharmacists work in a real life practice, right? And the fact that we have to always be learning and always reflecting on our own practice. And in my opinion, pharmacists never really stop being students or teachers with our colleagues and our other patients, all our patients.
Yeah, I think that's really neat how you reflected on that lifelong learning piece and that reflection. Having those multiple learners helps us learn from one another, and how that learning, that feedback is so important, and that learning doesn't stop. Mallory, as you've had two different levels of learners, tell us how you've integrated precepting those students into your practice.
So the way our residency program is set up, it works out quite well that the resident has already had a 4-week rotation wherever they are doing the teaching rotation with the fourth-year student. So they're already familiar with the unit and how things work and the staff. I have the resident and the student each look after their own patients, but then they can always turn to each other for questions, or I'm always available as well if they run into any problems. I really feel like the near-peer model allows the resident to really see how much they've learned so far during their residency year, and it also fosters their independence because they're kind of acting as the preceptor for the fourth-year student. It also exposes the fourth-year student to the residency program. They kind of get to see firsthand what a resident does. Another benefit is that it prepares the resident to have students in the future, because inevitably they'll be a staff pharmacist in just a few short months, so it prepares them to be comfortable taking a student right off the bat.
Yeah, and I can see how, for them to be that advantage of being able to be with a resident, you're right, would be very much promoting that program and their experiences. And when, I guess, Erin and Mallory, as you think about integrating them into the practice themselves, how do you go about assigning your patients? Do you guys want to maybe speak to that? I know I'm putting you on the spot with that question.
Well, for my last rotation, we did like triage, not every day, but regularly as patients would come up. And, I don't remember if we had a specific way we did it. We just sort of would look at the clients and sometimes I'd let the students choose or I'd assign them depending on how many they each had and try to keep it fair.
No, that's fair.
We would also just take a look at our patient list in the morning, and if anything popped out to either the student or the resident as maybe a diagnosis that they were particularly interested in, they were free to take those patients. And then, of course, patients get identified for us in the emergency department. Sometimes the staff would come and say, oh, you have a resident, this patient would be really good for them to look at.
No, I think that's really interesting, and I think it's a question preceptors commonly have. So Sahiba's with us today and is now a resident. So interesting, will actually be precepting in January, just like very similar to your program in New Brunswick. Alberta has the same approach with their residency program. But also Sahiba participated with Erin in peer-assisted learning. So Sahiba, if you could share from your experience what your experience has been as you've integrated with a peer learner into a placement, and what did you gain from participating in that experience?
Thanks, Michelle, and hi, everyone. I think one of the great advantages of the peer-assisted learning is that it really helped me to develop confidence with my clinical skills and working up patients. And I think one of the reasons why is that I really had the opportunity to practice my patient cases in front of my peer prior to going up to my preceptor. And I felt that this process also really helped to reinforce my therapeutic knowledge as well. And I think this is because I was able to explain various concepts to my peer, and then my peer was able to explain concepts to me. And it was really neat to kind of get that different perspective. So kind of hear various therapeutic concepts being explained from my peer kind of helped me look at things from a different perspective. And I think it really helped to solidify my understanding of different therapeutic concepts. And I think the other thing is overall, the peer-assisted learning placements, I think they just help to kind of reduce anxiety when you, as a student, like from a student's perspective while you're on rotations. And I think definitely one of the reasons is, yeah, you do get that ability to practice your cases before going up to your preceptor. And I think even smaller things like the technical aspects that sometimes maybe get overlooked. So having that ability, like being able to navigate through hospitals or, having training for software, it's kind of nice to have a peer with you that you can ask questions anytime. And I think again, like it's nice to have like a peer with you to have questions or be able to bounce off ideas, because I think as a student you need to understand your preceptor has other responsibilities as well. So I think overall it just makes the placements a lot more enjoyable, and I think definitely reduces stress. And I think overall that kind of helps. Like for me, definitely as a student, it helped me learn a lot more than I think I would have learned if I was feeling more stressed in an environment. I think there's also maybe some challenges as well, though, with having a peer-assisted learning placement. For me personally, my peer was actually a close friend of mine, so I think at times it became a little bit difficult in terms of how to provide feedback, and it was difficult in finding that balance and how honest I could be. But I think that for future students that do participate in this model, I think it's important to kind of have that discussion earlier on, before the placement starts, and just really be honest with each other. And I think at the end of the day, we're here to help each other, and we want each other to succeed. And I think that all of this is so that we can improve our patient care process and help our patients and be better practicing pharmacists. So I think if we take it through that approach, I think we can kind of work around that challenge of being able to really provide that honest feedback.
No, and thanks for sharing that and being honest with those challenges that you as a student, faced. And it's great to hear the advantages that you felt. And then also, it is difficult. And even I think when you're an experienced practitioner, giving feedback to a peer can be challenging, and when it's a friend dynamic. And so being able to talk about it early is a great idea. So thank you, Sahiba, for sharing that. Sahiba is also in her residency. I don't know if you want to just give a little summary of what you're doing for a residency project.
Yeah, for sure. I'm actually working on a residency project. It's basically a year-long project, and I'm working with Michelle as well as Anne, and we have 3 other people on our panel. And basically, this project is focusing on looking at getting pharmacy students' input on the peer-assisted learning placements. And it was really interesting because I did a background literature search on peer-assisted learning, and there was actually basically no information that's out there on what pharmacy students think about peer-assisted learning. There is information available on different healthcare, like such as medicine or nursing, but for pharmacy, it's kind of really lacking. So this is kind of it's very novel, this idea that we're going forward with, and essentially we're creating a survey, and the survey is going to try to determine what students really think are the advantages and challenges of the peer-assisted learning placements. And I think the other thing we're trying to focus on is what are skills that students think can help them succeed in these placements. So I'm really looking forward to working on this project with Michelle and Anne, and I think that it will be really beneficial, definitely, to kind of help us see what students really think, and then take that feedback and see how we can maybe move forward with future placements and make them a really great learning opportunity for everyone.
That's awesome. So thank you, Sahiba. So what tips would you have for a preceptor trialing this?
So for me personally, I think that as a preceptor, it's really important to, especially for someone that has never really tried this before, and I think it's really important to have that honest feedback, and kind of have maybe like a sit down maybe once every week with your students, and just kind of be honest and ask how things are going, and try to ask for feedback on how, as a group, the process can be improved and what things can be changed for the following week. And I think it would be really important to develop learning goals, maybe SMART goals, and kind of be able to brainstorm those type of ideas maybe over the weekend, and then come back the next week and try to really make sure that we can achieve those. So I think it's important to have those like weekly check-ins and make sure things are going on the right track and that everyone is really benefiting from these placements. I think that would be helpful for a preceptor, and I know that Erin definitely did this for me and my peer, and I think it kind of helped make sure that things were staying on track, and that there wasn't any frustration or anything developing from the placement. So.
Oh, excellent. It's neat to hear, the things that, as you experienced this with your preceptor, what was beneficial to you. Erin, what would you add as a tip for a preceptor trying this?
Well, I think we've said this already, but I think that setting those clear expectations at the beginning is really, really critical. I want to make sure the students know that I'm there to help and support them, but I can't micromanage, and I can't make sure that they've done their assignments, like they're responsible for that. But that's not new to peer-assisted learning. Like Sahiba mentioned, regular check-ins allow me to ensure the students are on track and gives me the opportunity to address any concerns that they might not have brought to me if I didn't directly ask them. Again, it's not unique. But the biggest tip I think I have is that I didn't really know how great it would be until I actually tried it. So the biggest tip I have is just to try it. If you get the chance, be the person to volunteer to have the 2 students, and then you'll see the value in it for yourself. So that's it from me. Thanks, Michelle.
Oh, that's awesome, Erin. And it just that jump in and do it, and you never know until you try. Mallory, what would you add for tips? I know you had more of a near-peer teaching model, and so what were some things that you'd want to pass on?
Like Erin previously stated, definitely have clear roles for the resident and the student that they're precepting, so that they know who's doing what and that they're working up separate patients. It really helps the flow when they know what's expected of them. If the resident can have their own laptop or workspace, it's very, very beneficial, but I know this isn't always feasible. But it helps when they have a learner that they can share the electronic health record on the laptop, and one can look at the paper chart and alternate. And then also, like Erin said, space can be tricky, but just be creative, and I don't think it should be used as an excuse or a barrier to the rotation. It's definitely feasible. You just have to see how it works out.
Well, fair enough, and I think, being creative around the challenges. So as we've, heard from all three today, so thank you, Mallory, Erin, and Sahiba for sharing your experiences. We know there's many advantages, and as they've highlighted, there can be challenges as well, and how do we overcome those? And so I know for me, as we've supported this here in Alberta, we have had a growing amount of sites that have been using the peer-assisted learning, and we've been, and near peer teaching, we've been working with sites to think about, as Mallory just shared, like, how do we be creative, to think outside the box for strategies for success, to overcome things. And so provided a summary, and we're going to, many of these tips have been collated. UBC and U of A came together to write some guidebooks, and I'm going to share a slide with the place to find those guidebooks. But to address some of these strategies around setting expectations, but also some of the challenges around space. And so as Mallory just said, being creative is really important. And so I know a lot of times here in Alberta, at different practice sites, we will hear, I'd love to have more students, but we really just don't have the space. And it's about being creative. I know myself, I work clinically. I work at the Tom Baker Cancer Center in a pain clinic, in an outpatient clinic, and space is very tight. We actually just kind of have standing space only when we have extra people. But we do have a counter, and we do have a laptop. And so they just don't get a seat to sit down. And so, finding those opportunities, maximizing that time that students can spend with patients, so that the time that they are at their workspace is truly to document and to research drug information questions and to do some of the work, but getting them off their computers and into the patient rooms, into the nursing units with the allied health is so important. If rounds are crowded, if you're a rounding site in a rounding hospital, or a rounding unit, students can alternate attendance or share with each other after. They can be in rounds for the patients they're following and then not present for the other ones if space is so tight. If limited computers, think about using those unit computers or empty spaces. I think Erin gave some great tips of just even someone's on vacation, someone maybe has gone away for the afternoon, and they can use a drop-down space, obviously with their permission and respecting their space. But scheduling that computer usage, students can use their own laptops where appropriate. They often can't do maybe patient-specific things on their own laptops. But they can be working on patient presentations and in-services and drug information requests on their own laptops, as I know there'd be restrictions to downloading software onto that type of laptop, but can be used. And there are some cases where different departments have extra laptops that are used for other clinicians, and they can be signed out for students. And then you can go old school and print documents so the students can work without a computer if needed. So being very creative and thinking of how you can address that space issue. The other thing that comes up that I mentioned earlier, the one that is a time commitment, is to complete the student performance assessments individually, one-on-one. And what we recommend is to be providing ongoing feedback during the placement to minimize any surprises and conflict, and that you'd be doing that ongoing, so that when you do sit down to do that formal times at midpoint and at the final, you're now summarizing the feedback and having those conversations with your student. Harriet is on the line, and there are some strategies where you can get an electronic copy of the assessment form and use it in Word if you want to be writing in the assessment. Often, because now you have 2 students or 3 students, writing down examples and comments as you go along really does help your midpoint and final assessments go much more smoothly. So scheduling that time to document your comments. Some preceptors do that as a running document for themselves and transcribe it into the assessment form. If they're printed assessment forms, you can be writing in it as you go. And important is to schedule ahead. So you do know that, because you know that ahead of time, many times then into your placement schedule, you could be putting, you'll do one person's assessment on a Thursday, the other one on a Friday, or if you want to do them back to back, it's how you want to organize your time to do so. So those are some strategies that have worked for other preceptors. When you're co-precepting, and just wanted to mention that because many people on the line talked about that they've been co-precepting, you can still be co-precepting and doing one of these models, whether it's near peer or peer assisted. So one thing we have found here in Alberta, and I've seen this in other provinces as well, Ontario and Quebec and BC, you will be perhaps using two or three models at the same time. And so when you're co-precepting, it's so important to be communicating on a regular basis, choosing your method of communication, so whether you're going to connect in person or by telephone or share by email and CC everyone. It's very important that at those handover times you're sharing the learner's progress. As you have two learners, whether that's a senior and a junior or two learners of the same level, sharing each's progress and where you're seeing the student excel or where you're seeing the student struggle and what feedback has been given is quite imperative to the handover from preceptor to preceptor. We have found that what can happen is that it can feel like the next preceptor is sort of starting over versus carrying on what the previous preceptor has done. Ensure that each co-preceptor is able to contribute to the student's performance assessment with their feedback and examples and compare those perspectives. And that is very important. Often preceptors will have different experiences from the orientation to the mid to end as the student progresses, and if possible, be present. I mentioned that there's resources available, and there have been guidebooks created for preceptors on peer-assisted learning, near peer teaching, and soon the co-precepting one will be posted in the next month. These guidebooks are very, very helpful to help go through what the model is, this what we've talked about today, strategies, they have checklists, different ideas, and then they also talk about sort of some of the different circumstances and strategies for success and ideas of things to overcome. It speaks to some other things like if there was conflict between the learners or competition between the learners. Some of those things are addressed in those guidebooks. So as we have our last 10, maybe 15 minutes, if because we started a few minutes late and I know everyone has to go on to other clinical things today, but it brings us down to kind of this thought of as you've heard us speak about peer-assisted learning and even near-peer teaching, as Mallory shared, are you interested in giving this a try? And there are options for 2019. Harriet is on the call today, and as you think about the placements, I do believe in the Maritimes all of the fourth-year placements have been assigned. But second-year placements, there will be a call going out for 2019. You have some options that if you would like to pilot one of these models, you can speak to your pharmacy manager or the residency coordinator, Corey, who's on the call today, and discuss those options. Maybe you're a site that's already had a fourth year assigned and you'd like to maybe rearrange how those placements are arranged at your site and give it a try to have the two students in one clinical area and being precepted. This is your opportunity, and we're certainly, as these resources are available to you, we encourage you to download them and take a look, discuss it with your manager, talk about it as a clinical team. And as a co-precepting team, what model would you like to engage in and how would you like to give that a try? And as Erin shared, she didn't realize how useful it would be until she actually stepped out and gave it a try. So we want to thank you for your attention today and being part of this presentation and from all over New Brunswick. And what we'd like to do is open it up for a Q&A time. I know that for some of you, there's 12 or so people in the room, 4 to 12 people. So You are welcome to unmute and share your question. And myself, Sahiba, Aaron, and Mallory are all here to answer any questions that you have. Feel free to unmute or even write your question in the chat box.
Questions?
And Anne is with us by remotely. She's been able to hear us, but just hasn't been able to speak through the audio. So no questions here in St. John. I have a couple back pocket questions. And I guess these are just some things to get people thinking. As you kind of heard about the model today, is there anything that interests you or motivates you to want to try it? Does anybody want to comment? You could be thinking, no, don't ask me, don't ask me. And I know we're in some different groups, so you might be discussing this as a group. If you're not ready, or you just feel unsure, or you're just thinking, oh boy, I just heard about all of this today and I don't really know what to think, what do you think your biggest fear is, or your barriers? Feel free to share.
Michelle, this is Doug. I've had multiple learners in both clinical setting and non-clinical, in the sense that we do a leadership and a bin rotation with our residents as well. So our leadership team here have all 4 residents. Sometimes we've had 5 where we've had additional residents join. So in that setting, there's usually great opportunity for discussion. We're not seeing patients, of course, when we do an admin rotation, but it really brings in discussion because it's not pure didactic. We like to ask them questions, get them thinking about different management and leadership scenarios. So most residents don't have a lot of insider experience working as a pharmacy manager, so it gives them a chance to, similar if you were in a clinical setting and you hadn't seen a certain condition in a patient or had experience with using a certain medication, they can collaborate and share information so they don't feel like they're in the spotlight all the time.
Yeah, it just creates that collaborative environment for everyone to be able to share and ask questions and not feel kind of on the spot. They're not the first, and particularly when you think of different styles of learning and learning styles, some are the first to speak up and some like to listen for a little bit longer and then share. So it enables that discussion. So thank you for sharing that. It definitely is a lot of value when we think of clinical and non-clinical placements. And I think as our programs grow, there become more and more opportunities, as the entry-level PharmD programs are launched. I know here in Alberta we have a lot more non-clinical placements that are offered as part of an elective. Glenn's written space, and so thank you, Glenn, for bringing that up, because I do think that even here in Alberta that is a common challenge. Does anyone want to comment, because I know from all of the groups, of strategies they might have used at their sites, and Mallory and Aaron both mentioned, but does anybody want to talk more a little bit about space and strategies for that?
Here in Moncton, in the emergency department, we're, I guess, fortunate to have kind of 3 different areas for patients. So there's acute, non-acute, and trauma. And sometimes when maybe we have a technician and a student and we're really crunched for space, sometimes the resident and the student would hang out in one of the areas away from the main preceptor, and I really find this helps to increase their independence because they're being asked questions, thinking on the spot, but then you're always not too far away if they need your assistance.
Yeah, no, that's excellent. So what you're doing is you're capitalizing on sort of that space that might be there that's not exactly 100% in the same area as your preceptor, or even maybe the patient you're following, but you've got a touchdown space that you can be working. Anybody else want to add to that? I know we have collective experience around the province if you've been trying these models as well.
Certain times of the year, too, we're all clamoring for access to PCs. So the nursing units themselves are quite busy with 6 to 8 nursing students, a physiotherapist and a physiotherapy student, a dietitian and a dietetic intern, and then you throw in a few pharmacy students, medical residents, the population of the unit doubles, and then we're all clamoring for PCs to get access to blood work and to do some documentation. So it can quite look like a circus many times. So you're cognizant of that, and our preceptors feel bad and don't want to add to the population problem.
Yeah, and that's come up, I think, in many other sites as well, because we aren't the only profession having learners. Like you mentioned, the nurses, the medicine, PTOT. There's some different strategies folks have done to mitigate this or to, I guess, work around it. Some of it's scheduling. So as a team, if you're able to talk to the various providers and sort of find out, like you mentioned, it's sort of ebbs and flows a bit. Like when you start to have an awareness of the other schedules, sometimes that's when you can time having your students in perhaps a different block than all of the, say, nursing students, because I know when they come, they do a group model of teaching most often, where there's 6 or 8 of them. So sometimes knowing and having like a conversation ahead of time with the unit as to when everybody's coming. I realize sometimes not every unit knows when everybody's coming. They all just sort of arrive. But that can help. So, that helps you determine which block might be better if you're doing that. The other thing that some sites have done, and really this is sort of up to I guess your management and what resources are available, is having a few laptops, and I don't know if you're Wi-Fi compatible, but we have had some sites for us actually invest in some laptops. They're probably not the fastest. I'm not going to say that they're state of the art. I have had students complain about how slow they are, but they're laptop. Maybe they were refurbished within the organization, but that has also helped with having an extra spot. And then the piece is, I guess the other piece is being, there, basically the whole use your time wisely on a computer, look up what you need to look up, and then get off the computer right away. I think we are quite used to being able to have our own station and be tied to the computer, but I think even in clinical practice, I know we're encouraging, we need to be with our patients. And so students can look up things when they're in the pharmacy, get all the information they need if they have to print it or they write it down, then go see their patients, and so less need on the unit, and maybe just checking some things. You have to be creative though, for sure. Any other barriers or things, or someone would like to add to that? And Erin, Sahiba, I know Sahiba.
I was just thinking, Michelle, about our community colleagues and how often they stand all day long. So that standing room only isn't necessarily the worst thing. So.
Yeah, I think I know I had a student who just we like I stand at a counter all afternoon myself when I'm in clinic, in and out of the patient rooms. You have to ask. I know I had a student who had a sore leg, so we just had to make sure there was a sitting spot for them. But you tend to, if there's any medical needs and restrictions, but have some opportunity. Any other barriers that come up? So I think these are valid, so good to talk about. Anything from Fredericton? I don't know if we've heard from, or maybe Glenn, you were writing, no, you were writing from Moncton, I think.
Oh, Glenn was from Fredericton.
Oh, Glenn's from Fredericton. Thank you, Glenn. Trying to remember where everybody's from, sorry. And the Miramichi, Keith and Susan, anything you'd like to kind of bring up, or pros and cons or thoughts that come to your mind when you think about these models? Heather and St. John, as we've talked about some of the challenges, anything else from your group today?
This is Corey. So no, we have a quiet room here today. So no other questions. I think our biggest barrier we've already touched on is again going to be the space and the computer access.
Mm-hmm. So one suggestion that I have, we've done this with some other sites because I've worked one-on-one with sites as they've been implementing this, is the next time you go up to your unit, so here's my challenge to everyone, is the next time you go to your unit or go into your clinical area, just step back and look around and just watch. Watch where everyone is, watch the ebb and flow of the use of stations, look down the hall, look at sometimes these extra rooms that get created. Sometimes I know they're manager rooms or unit manager rooms, maybe they're teaching rooms. Really just stand back as an outsider view and look at the ebb and flow and all of the different things that are occurring. Each person's unit, whether you're in an ambulatory practice or an inpatient unit, does look different. And just take note and maybe write down where some of these possible pieces of opportunity for either space or computers exist, and think about this flow of when people are using them. So I know depending on how your unit runs, rounds are at a certain time, all of the physicians are here at a certain time, that will be a very busy time, whereas once they leave and go back to perhaps their own practices, the afternoon is quieter. So take a look at not only where everybody is, but also the schedule of the providers in the room. And so I can see here a question in the chat box from Glenn. Doug, can students access Roam and not to date? Is Roam like a Wi-Fi piece?
Remote access, so they could access via their own laptops.
Mm-hmm.
Then they could access the clinical record during rotation.
We haven't moved there in Alberta either, Doug. That has a lot of its own complications. Here in Alberta, we would have restrictions on personal laptops being used even by myself as a provider. We really stick to organizational issued laptops. Students can use their own laptops, though, to do things like, as I mentioned, patient care presentations. We would tell them they can use their own laptop for anything that does not contain a patient name or violate any confidentiality steps. So I know we're at 10:07 for me, which would be 1:07 for you, and you guys are off. I know this was a 1-hour time slot for your ground round, so just wanted to let you know that as you think about those first steps to get started, please reach out to Harriet, to your manager, to Corey as your residency coordinator, and think about those options that you would have for adapting this. I want to thank again Mallory for sharing your experiences today, and as well Aaron and Sahiba. Anne's been listening, so thank you, Anne, for being a cheerleader and a supporter, and Anne and I would have been co-presenting today, so you just unfortunately didn't get the pleasure to be able to hear from Anne today. But we sincerely thank you. We support you. If you ever wanted to speak to a preceptor from Alberta or even from another province, Anne and I, would be able to be contacted, and we can connect you with someone. Aaron and Sahiba are here on the call as well. So we wish you all the best as you consider this. Thank you for the invitation to be part of your ground rounds today.
Thanks, Michelle, and I just want to echo your thank yous to all of the participants today and all the work that went into this presentation. You have certainly given us a lot to think about and a lot to maybe investigate at our site, so hopefully we'll be able to implement some of these models in the future and maybe the very near future. So we really appreciate your time and efforts today. So thank from Horizon to Michelle and Anne, Sahiba, Aaron, and Mallory. Thank you very much.
You are so welcome. I'll put the link in the chat box for the Models of Precepting guidebooks, and I know that the Doug has a copy of the slide deck today that can be shared, so feel free to review that material and the resources that are provided there.
And for anybody who missed today's presentation, we have recorded it, so as well as this, you have a recording of the presentation that Heather will send out to the folks in the audience or to the different sites. So thanks again, and we'll sign off. Thank you.
Have a great day.